My name is Lizzie Rinke, and I am actually a fifth year at Calvin. I changed my major, but now I am a senior nursing student. I really loved how small Calvin was, but also how intentional professors were. And I also really liked just all the programs that they had, the opportunities, and the Christian education was really important to me too. So what attracted me to nursing was that I noticed that nurses were making a crucial difference in care compared to maybe the provider was, and you still have that one-on-one interaction. So I hope to, after Calvin, I would like to work as an RN for a while, preferably on a med-surg floor is what I'm thinking, and hopefully get my way into an emergency room. I'd like to build up some more experience before that. I would consider possibly doing a nurse practitioner sort of thing. Also getting my master's in nursing is an opportunity. I'm actually an honors student here, so I do a lot of research, and that's interesting to me as well, so going back and doing more of a research background. I'd say that the nursing program at Calvin is rigorous, but the professors are super supportive through that whole way. And even in our most challenging times, they were there to help support us along the way. With this switch from going to more simulation now, I knew that you would practice on dummies, but I didn't understand the extent to which simulations were. And I also didn't expect the extent to which the rigor is for a nursing program. One thing that was different coming to Calvin as a Christian school is having devotions at the beginning of every class, or some aspect of faith was integrated into each class, which is really special. I didn't experience that coming from a public school. So some of the big things that we're talking about this semester, the bigger picture, is that we're image bearers of God in our nursing practice. And I can think of one specific quote is just how when we walk into a patient's room, it's like holy ground. And how we are servants for Christ in that way. But also seeing Christ in our patients as well is another big thing that we've talked about in our nursing career. It's not just about sharing the gospel at the bedside, or maybe if someone is dying, making sure that they're saved. I think it's more about just showing Christ in all of your acts as a nurse and being a servant in that way, which also brings glory to God. That's another thing we talk about as Calvin nurses is just it's called the Reformed Christian worldview. But just the brokenness in this world, being in the ER now, I see even more brokenness than I've ever seen in clinicals, and it really it does make you consider your faith and as a servant nurse, I guess you would say. The new sim lab really makes a difference because it is more like a hospital setting, spiking a bag of IV fluids or pulling medicine from the medicine cabinet, scanning barcodes, things like that. It does seem more realistic. In the beginning, starting here or in these labs was interesting because we had no patient interactions yet in the hospital. But now that we have had some patient interactions, we get to practice our skills even more in the new sim labs.